The Tulsa Fire Department is starting a new program to help people who might be going through a mental health crisis. News on 6's Caitlin Deggs is live downtown to explain how it works. Caitlin?
Jonathan, the alternative response team will have one therapist and one paramedic, and they'll respond to situations where somebody might be suicidal, acting out, or overdosing. This is an expansion to the department's community response team that responds to calls where the person might be going through a mental health emergency. Therapists say this has been life-changing for families.
Think about if you had a loved one, and instead of them having to go to an emergency room or being transported by an ambulance and incurring that bill, if you're able to stabilize them in their home.
This team can help get things under control and potentially stop someone from having to go to jail.
Sometimes these turn violent, and that's an unfortunate consequence. But if we can prevent that, we can prevent the emergency room as being the primary source of care for some of these folks.
They say that while the therapist can help with the mental health side, the paramedic can make sure the person is physically okay.
We also have recognized that a lot of our mental illness is also a manifestation of health problems. So that's where the paramedic comes in. So determining if somebody is potentially having a stroke or is having low blood sugar or something like that.
The therapists say they will continue to help make sure the person has the mental health services they need, even after the initial call.
The mental health system can be very complex and hard to navigate if you don't understand it, and especially when you're just being stabilized from a crisis situation. So having someone there to really walk through all of those difficult processes and steps with someone is very important.
And the team started their first shift this morning, and they will work weekdays from 10 to 7. Jonathan?
Caitlin Deggs live for us in downtown this afternoon. Caitlin, thank you.